to figure that out. So what I did was to look a little bit of the research in your area, and this is not a comprehensive search that I did, but I want you to know there is a lot of it out there, and a lot of it is dated in about the last 5 years that's tied to literacy. Now, I'm not talking about asthma research, period. I'm talking about it as it's tied to health literacy. And so here, if you went in the Journal of Asthma, here's about a patient's assessment of health care and medical decision-making, the role of health literacy. In this previous session, where we were, some of you were in there with me, remember the woman was talking about how they assess the quality of their care. This would be in relation to health literacy. This next one, a systematic review of asthma health literacy, a cultural ethnic perspective in Canada. I really did look at that one quite a bit to see what they saw were some differences that might be of interest. They looked at multiple studies is what they did there. This one, tailored education may reduce health literacy disparities in asthma self-maintenance. This man here, Pashlow, is very involved in health literacy, and you see they're showing it may. They're doing just these initial studies that are going to get us to the point where we can then do, where we can definitively say, if you do these things under these conditions with these sorts of people, this is what you could expect. You know, I personally like to get to where we can start to predict, you know, and then you can narrow down where to put your energies. And one of my first research studies, we collected all kinds of data, we kept factor analysis, and finally I got to where I could say, if you'll work with me on this and collect these 7 pieces of information, I can pretty much tell you how this is going to turn out. And then we would do the testing to see if it did, and it held up over time. But it took a long time to find out that those 7 pieces were what we needed to know. This one I lifted a little bit about what they showed, because this is on impact of health literacy on longitudinal asthma outcomes. So here was an example of an actual longitudinal study, and they were seeing that less health literacy was associated with poor longitudinal outcomes, both directly and indirectly, and depended on patients' knowledge and their self-management. And so their recommendation is that you should focus on improving literacy skills that are required to learn, understand, and implement effective self-management. That would be a controversial recommendation in the field of health literacy right now, because it's all saying get the patient to be better, okay? And many people are saying it's not, we can't do that with every single person and raise their literacy level. And besides healthcare providers, that's not necessarily your skill, right? You weren't trained in adult ed. So I point that out again, just to show you. This one I found particularly helpful, the effects of health literacy on asthma self-management. This is a very recent one, April of 2010. Low health literacy is associated with less accurate metered dose inhaler technique. I'm sure all of you understand what this is. Less use of peak flow meters and asthma action plans. Less ability to calculate peak flow zones. Higher rates of emergency department visits and hospitalizations, and less desire to participate in decision making. Just tell me what to do, and I may or may not do it. Right? And throughout my teaching career, students want me to tell them what to do. And I said, as soon as I do, you're going to say, I'm not doing that because you said so. So you tell me. Well, I don't know how to make that decision. Then let's learn how. So that it's your decision and you own it. And still another one here, parental health literacy and asthma education. And they were doing a test through an emergency department. It was a pilot study. And they were actually using video-based education, and they found it was a promising tool. Remember, for those of you who were in there with me in that other one, it's not a tool, it's a tool kit. It's a set of tools that probably will make a difference. So what can be done? Well, we want to increase the likelihood, or the odds, that the interaction with an individual's skill levels, plus the professionals they encounter, and the supports that are available to them, equals the intended result and the ultimate health outcome. That's the formula. Now, so many factors play into that, but that's the formula. Playing out the role, we're going to skip through some of this. There was our task. There's the, we've already talked about that. A number of you saw me show some messages and the results, the early results of a study that's going on. in the previous session, for those of you who didn't, the relevance of this, of what I'm showing you, is that we have to start with who we're working with and try to know and understand. And yes, there will be some generalization, but you're trying to understand within some parameters what's likely to be going on with people. And so we were trying to understand what it would take to have health messages that would fit their lives. And so you can see here that they were acknowledging that they wanted the message to be crafted and acknowledge their own life, and that it should tell them some steps to take. And that they wanted to know the consequences, both positive and negative, of doing or not doing. So what I was going to have you do, and just the way all that kind of turned out, I actually was going to have you create an asthma message using what we have learned so far, or what we're finding here. But that would be the test for you to be able to get it into your head, is how to make your message connect to the person. So if you're nowhere near needing to apply for Medicare, it's probably not going to connect. Do you have someone in your life that you might be able to help? Bingo. Yeah, I'm connecting. I understand that this could be kind of complicated if you've never been through it before. Have you ever applied for and fill in the blank for something? You know, what made that difficult for you? You know, actually you can get a lot out of a few questions strategically placed, and after a while, if you listen to the answers that you're getting, you're going to figure out which of these are giving you the clues that you need to know. I would ask you to, in that message, to explain some steps. What we're seeing is not too many, so I get lost, but enough that I'm going to be moving down the direction I need to be moving. And make sure I understand what could be the benefit and perhaps the negative results if I don't. Say what you mean what you say. Time to reflect. I know that we had to cover quite a bit in an hour and cope with this a little bit, but what so far out of this is like one thing that you heard or that made some sense with your professional practice that you think you could do to help promote better communication? And I say that you teach because in one way or another you're teaching. Something that you got today. Ben?
When we talk to students and at the school, walk them down to the pharmacy, so not only will you know what a pharmacy is, but they will also know. And then the relationship between, if that patient comes back to you again, they have a better bonding with you in terms of some of the other aspects that of their care that they can bring forward.
Because he or she took the time
exactly.
to lead me there. By the way, the students in our health literacy graduate class, we give them an assignment to navigate. They have somewhere they're supposed to go in a hospital, and it has to do with their assignment is there to get an x-ray, and they're supposed to go to the x-ray department. Very common, right? Also called radiology. Now called imaging. Yeah. You know, and they all come back and they're telling about their different stories. And so, but you told me to go to X-ray. I'm literal. I'm looking for the X-ray department, right? You didn't happen to mention it's called other things. So very good. Good takeaway. Yes.
Know your audience or know your target population and see everything from their point of view. That was something that we learned today about knowing who they are, and I think it was something that you said, Ms. O'Keefe, about knowing your audience and seeing everything from their point of view or their perspective. I thought that was good for me today.
By the way, a little technique you can use to kind of check that out is you could say, like if I was talking to some rural mothers, I could say, you know, other rural mothers have told me that, thus and so. Is that true for you? No? Okay. Or, yes, you mean other people have that too? You know, and then you found what's relating. So you may have to ask 2 or 3 of those little feeler kinds of questions that takes the onus off of them and kind of puts it on you. Or I have been told, you know, I have been told that people have problems finding the X-ray department. Let me give you a little clue. And you put it down. This is what you're looking for. And there's a symbol there too, I think. You know, this is, and maybe if you've got enough of this, you've already got it pre-printed here. You know, this has come up so much. And then they feel like, well, gee, other people have it. And it really isn't. It's a pre-thinking. it's a pre-thinking of what would it take to get there or to do that. So yes. Anything else?
Yeah, one thing I think that you said is very important that we have to remember when we're out with the people that we're trying to help, is that we don't know everything that's going on with them, that's keeping them from receiving what it is you have to give them. You know, that happens so often.
Yes.
You know, that, you know, they may have something on their mind that when you, even though they want your information, there's this block.
Yeah.
Because they've got other stuff going on with them.
Right, and again, if you've done some probing, you may know some of the reasons that could be blocking, right? Anything else any of you want to say that you're taking away from here? Yes.
I think I'm kind of excited because I didn't realize that one of the things that we do, we're very lucky with a lot of our referrals. The health department's already been into the home and has already provided a lot of the education that we follow up with. So one of the things that that we're already doing that I didn't even think of as a health literacy maybe tool is that we go in and we ask, what did the health department tell you? What did they teach you? What did you learn?
Okay.
And then that way we kind of use that because it kind of lets us know, okay, well maybe we don't need to follow up on this, and this is where we do need to follow up with doing more of maybe rights education and those type of things rather than cleaning practices.
Good. Well, it sounds like you've taken a variety of things out of a little short period. I want you to take, if you want it, our brochure about the center. And I would tell you that this brochure was the product of a graduate student class where they were taught plain communications, and they were taught the principles and practices, and they had to keep working and revising until we got this one that we have here. It was nominated for a National Clearmark Award, and in April it received a Clearmark Award for clarity of message. And I could do a whole class on why everything is here. And just because this one happens to be kind of slick looking doesn't mean that your printed things on that you run through in your office can't follow the same principles. But we were using this to announce, in essence, the center. And the other thing I want you to know about that center, and I do have my card here, is that on June 1st and 2nd, we launched Health Literacy Maryland. And we had approximately 75 people come to our campus to answer the research question of, is there the will to find a way to collectively work on health literacy in the state of Maryland? And because I started moving immediately after, I haven't looked at all the data, but basically I can tell you that the answer is there is the will, and the center is willing to lead the way, and there were people who said they would step up to kind of steer it. And so this may be something that you're going to want to know about, maybe perhaps go forward. So if you would take my card and send me an email, we'll get you on that list, because it's like a snowball. We want to start getting more and more people involved. If people see that there's some value to doing something collectively and learning from each other. So with that, I believe our time is up, and I saw that sign there, and we need to get on to the next event. Thank you all for your engagement this afternoon.
Before you all leave, can I just remind you of some things that we do kind of before you go?